I think we all know inherently, intuitively, that the role of a mom is a big one. And it really is, as from a mineral perspective as well. So the baby essentially gets a blueprint, they get their mineral status from mom. So if mom goes into pregnancy mineral depleted, then she's not going to be able to give the baby that as much of a download as that baby would have gotten had she been replenished. Also, stress is a huge mineral depleter. So, I think that is ultimately the biggest root cause of health problems is stress. So, we take pregnancy, which is already a stressful experience. If it is a stressful pregnancy, which obviously lots of things cause it to be stressful, then again, there's less minerals to be giving the baby. And also less minerals for mom to feel better during the pregnancy and recover quicker. But there's a couple of really cool things that I like to point out to people that I thought was so unique when I learned it. So we hear a lot about iron in pregnancy and the importance of supplementing with iron, but we don't hear a lot about copper and what an important part copper is in terms of the mineral download. So in the third trimester, there's some interesting things that happen with mom minerally. One is that it is intended by nature that hemodilution sets in, where mom's iron level drops. And there's a reason for it. There's a reason for it because the body cannot produce milk if heavily iron overloaded. So the body is in preparation to produce breast milk. So therefore, the iron level drops. And then there is also a pretty significant copper download that goes from mom to baby. So when we look, if we were to look at the liver of a brand new baby, that liver is going to have about 10 times the amount of copper that you and I would as adults. So that says something really important about how special copper is.